a lot of what we know about the coronavirus, in fact, a lot of what we're doing to try and prevent, exposure or to prevent progression to disease comes from what we've learned about with these other viruses. So if you take a step back and think about, like, how are we going to handle this pandemic? There's different ways of thinking about it. Right now, we're in the stage of social distancing, preventing this herd infection, which is where we're flattening the curve. We're trying to stay away so that we can limit the number of people who get exposed. So we don't have a whole bunch of people going into the hospital at the same time because of severe conditions. Then there's the notion of vaccination, which everybody's really getting excited about. We'll get this vaccine and that'll solve all the problems. But there's controversy about vaccinations in general. There's, in the space of integrative medicine, functional medicine, the idea of vaccinations and autism and the relationship is there. So, everybody can't be vaccinated. There are people who know, based off of their own genetic profile, that vaccines don't work well with them, that they have reactions. So I think, it's important that the developers are taking their time to really make sure that this is a vaccine that can be used by the majority, and that it's a safe vaccination. But we're not there. So where are we? Well, we're actually in the space of number 3, where we can focus on these non-toxic treatments, right? These are the things that I anticipate, and I'm hoping that you will go out and start to use. You will use these vitamins, these supplements, you'll change some of your lifestyle so that when you are exposed, and I keep saying when, because I think we have to be realistic, just like the flu, most of us, if not all, have had the flu. We've been exposed to that virus, and the same thing will happen with this virus. But we want you to be prepared. And then the last thought is what we did. Well, I shouldn't say we, because I don't think I was in that era, but there was an era when you had chickenpox, you just kind of went with the other kids and everybody got chickenpox at the same time. And that was okay because we had treatment to get through those symptoms. I'm not saying we're going to throw everybody out in the midst of this virus, because right now we don't have a protocol that we can use like we did with sort of chickenpox. But it's a thought. So in the end, the goal is to develop this lifelong immunity, for all of us, to be immune, so that at least 60% of us, and that's sort of the number that we're aiming for. But along the way, we don't want to be immune or develop immunity where we end up getting so sick that it causes damage, from the infection itself. So how we respond to this virus, this exposure, depends on our immune system. And that's the important piece. That's what, once again, we're talking about today. So CDC is recommending, stay away, right? The focus is try not to get the virus. And as I said, that's fine and that's important, but what we're going to focus on today is, okay, let's be realistic. We know you're going to get the virus. So what can we do? How can we support your immune system? And these interventions are really the same things that we recommend in functional medicine for any condition. It's all about, and has always been about, what you're eating, how are you managing your stress, and what vitamins, based off of what you need, what herbs can benefit you. So this is sort of what is necessary to really focus on your immune health. Another way to think about this pandemic and the actual condition is sort of, where are you? And hopefully most people here are not even on this screen. Like, hopefully most people are in the preventive stage, where they're just trying to make sure that they're not going to contract the virus, or if they do, then they're only going to have that early stage and then they're going to come right through it. So think about maybe over the last few months even, I know a lot of people have come to me and said, maybe I was I had it. I don't know. I had a sore throat. Maybe it was my allergies, my stuffy nose. So it's really not, we're not really not sure. And we won't know until we assess people on the other end in terms of their immunity. But then it can get progressive, right? That's when you hear about, and I have friends who have had this stage, or they've been in this stage. Was it just influenza, the flu, or could it have been COVID? This is, at that point, we really weren't testing. And then, of course, trying to prevent the next stage, which is where people are going to the hospital. Just a little bit about the lung anatomy. Remember, you have sort of large tubes, and then it branches into smaller tubes, and then you finally get into what they call the alveoli, or the alveolar sacs. And this is what you hear people talking about when they're in the hospital and they're having this cytokine storm. It's what ends up happening in these alveolar sacs. This is where oxygen is being is carried, and the oxygen is being diffused through. So these sacs get infected. They get sort of filled with fluid and inflammation. There is a coating called surfactant, and there are some herbs that we actually use that help increase this amount of surfactant, because the surfactant is beneficial and it helps keep the airways open. And we'll talk about that. All right. So I'm going to step back and lighten it up a little bit and talk about grandma's remedies. And I labeled it this because I think if you think about like your grandmother or great grandmother, depending on your age, when you got sick, like what did she do? What were her recommendations? And these are some of the things, right? I mean, the bone broth and the vegetable broths. And I actually have patients use bone broth for their gut health. It's beneficial from that. The teas that we consume, right? So there are a lot of teas. Chamomile tea, we use it for sleep because of the magnesium. Ginger tea has antiviral properties using lemon and honey. And then there's a tea we'll talk about called Histus tea. And then thinking about the virus itself and where it infects, the nose, the oral pharynx, the upper airways, the goal is to try and keep those airways and that mucosa clean and healthy. So gargling with warm salt water. We'll talk about propolis, which is another herb that you can use, or using zinc lozenges or other types of lozenges. And then, back in the day, like you would boil water and you'd put it in a pan, right, a bowl, and then you'd add like eucalyptus oil. You'd stick your face down and put a towel around it. Actually, I still do that, and I do that as well. The idea behind that is getting the supporting the mucosa and helping the mucosal stay safe, stay healthy, so that if that virus, it's less likely to attack and invade if that tissue is healthy. There's a lot of oils that you can use, and we'll talk about oils as well. And then a lot of people have sinus problems related to allergies. So we encourage people to use like saline irrigations. So we say, come in the house, wash your hands, but also try to, wash out your nose, especially if you're out and about, like at the grocery store, because of course, you could have been exposed at that time. As I mentioned, we learned a lot about what we're doing now based off of, our history, and Spanish flu was one of them. This is an article from that era, and what they're commenting on is sort of how do we address this? Well, number one, we isolate, which is what we're doing now. Then we vaccinate. And then it says here, third, each person should keep as well as possible by proper habits of eating, drinking, sleeping, exercising, and breathing. And these are the things that seem so simple, but there's science to support the benefit. And these are some of the things we want to talk about. Starting with food. There are certain goals of food when we're trying to decrease this infection. And the broad idea is that we want to have food that is anti-inflammatory. We want to have food that has high antioxidant content. And then we want to eat food that really supports the gut microbiome. Because what we know about the microbiome is that 90% of our immune system is there. And it's important to maintain a healthy microbiome, and food can do that. And we'll talk about it. These recommendations, if you were to look at them, these are recommendations that, I would give to my patients just kind of across the board. So this is not necessarily something that we're going to stop doing after we've, dealt with this virus. I mean, these are things that we want to start to implement now and then continue on because they have a lot more benefit than just what we're dealing with now. And that's a lot of fruits and vegetables. These nutrients are, and we want diversity and we want colors because the more colorful, these are the things that actually support the gut microbiome. These are microbiome meaning the bugs and the ecosystem that sort of lives within the intestinal tract. High fiber is important. Fermented vegetables. Fermented vegetables because they contain probiotics. And probiotics are the good bacteria, and they help maintain the epithelial health and the gut health. And epithelia is important because when we talk about these mucosal layers, like this upper respiratory with this virus, that's what we're referring to. And then my kids don't like this one, but really staying away from the sugar. If there was any time to not enjoy your ice cream, this is the time, unfortunately. And the reason is, or at least one of the reasons, we know sugar is inflammatory. But the other thing is, sugar actually has been shown to damage what we call the macrophages. The macrophages are the cells, sort of part of our army, that actually attack the virus. So if you eat a bunch of sugar, basically you're damaging your army, and the army can't then attack the virus. So hopefully we're limiting our processed foods during this time. I know it's difficult because we're at home and we often use sugar as a coping mechanism, but it's important to understand that this is definitely a time to try to decrease the amount. This is a list. I know you can't see it well. It's really designed to kind of just show you that these are all the colorful vegetables, and it's important. So I tell patients, what I want you to do is next time you go to the grocery store, I want you to pick out a food that you've never had before. You may not even know the name of it, especially a vegetable, and I want you to come home and cook with it. You can look up a recipe, or you can just throw it in stir fry, and won't necessarily taste it because you're putting in other things that you do like. But the idea is you've got to get diversity. We are stuck with our, 5 to 6 vegetables that we like. We need to kind of step out and try different things because the more colorful, the more diverse, you get additional what we call phytonutrients. And phytonutrients are the chemicals in these foods, the reason why we eat these foods, at least in part, to help the immune system. They're called immunomodulatory. They sort of change the immune system. These are some examples of foods that hopefully you have in your house. If not, next time you get to the grocery store, get these things in. Lemons and limes for the C, garlic for its antiviral, ginger for its antiviral. So these are some things that we want to make sure you're consuming on a regular basis. Cooked mushrooms are other beneficial foods, trying to do more warming foods versus the raw type of diet. And then getting in more foods that we call bitters. And bitters are important for the liver. So when you're at home drinking your alcohol, balance that with the bitters. I mean, you want to be able to sort of clear these toxins. Bitters come in herbs, but also these are types of foods that are bitters. The first one is endive, and I'll tell you, I didn't know what endive was a year ago. I didn't grow up eating these types of foods or these. So, that's why I say you have to go to the grocery store and just try different things. Dandelion, things like arugula. These are foods that are considered bitters, and also turmeric, which is another spice. Boiling and steaming. So if you think about how you're preparing your food, I know in my neighborhood there's been a little bit of more grilling going on, and I know there's frying, but really we want to try to focus on waste of food that lowers inflammation. High antioxidant foods, and I will challenge you, you probably have some of these herbs in your cabinets. So this is the time to really cook your food and throw in a lot of different spices. And hopefully some of these are part of that. The other thing, as you're making smoothies, you can throw in a lot of these herbs as well. I'm happy that chocolate is an high antioxidant food, but we're not talking about Hershey's Kisses. We're talking about chocolate that is, 70% or more of alcohol. So it's the bitter chocolate. We talked about the gut already, but once again, it's important that we eat whole plant-based foods. These are the nutrients that support the microbiome, and the healthier the microbiome, the healthier you are. Your immune system, as I said, is within the gut, so it's important to keep the intestinal health healthy. And the thing to think about as well is that, remember, all those nutrients, the ones that we've talked about and the ones that we're going to talk about, they have to be digested properly. So there's no point in taking in all these good food if your body can't digest it. And so digestion, a part of that is important, or is related to having a healthy microbiome. Fermented foods are also important. These are foods that have probiotics in them. And so once again, having these good bacteria are going to be helpful for the immune system. All right, let's change subjects a little bit and talk about lifestyle. Hopefully, many of you are doing these things, maybe even more than before, and for some, maybe even less. So, reducing stress, we'll go into that. Making sure you're getting adequate sleep, which is critical. Physical activity. Now, I say physical activity and not exercise, and that's because it's important to recognize that just movement is relevant, and movement will help. It'll help circulation. It'll help support musculature. You don't have to be doing, gym exercises to get benefit. Stretching, yoga, these things are important, and they're helpful during this time. Too much exercise may be a problem, especially if you're putting a strain on the adrenal glands. These are the glands that sit above the kidney. They actually are involved in sort of the fight or flight. So when people are just constantly doing these high intensity workouts, for some people it actually can be problematic, and it can be more of a strain on the adrenal system. And then social connections. So let's start with the idea of meditation, mindfulness, managing stress. If you had asked me to talk about this, probably 2 years ago, I would have thought this was like frou-frou medicine. Not sure if you can see that on the screen. Let me. Give me 1 second. Make sure. Okay. I think I'm still. My screen is stuck. Give me 1 second. Let me figure this out.
There it is.
Go. All right, there we go. How about that? Okay, so the idea of meditation and mindfulness, as I was saying, is something that is fairly new to me. But there's science to back it up, and we know that incorporating these techniques actually improve immune function, among other things, but it definitely improves immune function. So it's important to be able to figure out how you're going to do these. And it doesn't have to be sort of the classic meditation where you're you're chanting or something. It really is just like waking up in the morning and staying in the bed for a minute, kind of grounding yourself. Mindfulness is sort of the opposite of multitasking. And I used to feel like, I accomplished something if I could multitask in a day, but really it's important to be focused, especially with everything going on. There's a lot, for those of us who are homeschooling, there's just a lot in the house. There are a lot of people in the house, a lot of activities. And so it's important to just kind of stay focused. And that's where mindfulness comes in. All right, other techniques that you can use for managing stress. I'm a big fan, those of you who know me, of using essential oils. I've gotten my kids using essential oils to help with sleep and relaxation. I recommend it for patients, putting a little diffuser by your workstation or when you're going to bed. There's a lot of different oils. They have different properties, but there are definitely some that you can use before to manage stress. Magnesium is a wonderful mineral, and unfortunately, many of us are deficient or have low levels or insufficient. Magnesium is important. It's considered sort of the nature's chill pill. It is. It's the anxiolytic property. It actually can lower blood pressure, and that's important because if you think about it, those who have higher risk factors or those who are at higher risk of COVID-19, they do have high blood pressure. So adding this would benefit them in multiple ways. It's involved in a bunch of different chemical reactions. Magnesium is involved in 200 and 400 different chemical reactions, so it is essential. You can get it in different formulations. I like people to do Epsom salt baths because you can get it absorbed in the skin. And then you'll see, the idea of getting in music, dance, and sort of the arts is important during this time. We just had a Facebook Live with my college. So it was like a dance party, and you got to connect with people. It was, and I know they're having these all over. So that's another way to sort of connect, but also to get into music. And then laughter. During all this, you've got to find some humor in the madness of it all, so make sure you incorporate that. And then information overload. We all, I think, technology is wonderful, but the downside is so much information. And even planning or preparing for this, even today, I'm looking up stuff and learning up new things, and it's just constantly changing. So be careful. You've got to turn some things off so that you don't have to deal with so much information, because that can be problematic. All right, let's talk about sleep. So sleep is fundamental, and there are times in our lives when you have kids, or you're in residency, or you've got to do something that's due, that you're not getting enough sleep. But in general, we really should make it a priority. Sleep is the time when the body heals. Sleep is the time when we actually produce these cytokines that help with inflammation. So sleep is fundamental, and it's good quality sleep. And there's some techniques that you can do. Your environment is important. You want to have a very cool room for those who are going through menopause or having things like hot flashes, or just want to be in a very cool environment, but the other person in the bed doesn't enjoy that. You can do, they call them cooling mattresses, and that can be helpful to keep your temperature at a certain level. You want the environment to be quiet. You want it to be peaceful, which means you can't watch news an hour before you go to bed. That just messes everything up. It's important to kind of turn off the electronics. Don't drink too late at night, making sure that you're trying to stay away from sometimes people respond to high protein meals at night, and it can affect their sleep. So the other thing with sleep is sort of the concept of Wi-Fi. And in our house, our router is downstairs, so it's not in our bedroom, which is important. but also, the phones have to be turned off into airplane mode. My kids know that. And then you've got to also take the phone and don't put it by your bed. There's actually some research that looks at the effect of Wi-Fi and melatonin. And we'll talk about melatonin as a supplement that you can use. Melatonin is supposed to come up, increase at night. And if you're constantly sort of on the computer or on your cell phone, that light can affect your ability to make melatonin. So, blue light blocking glasses can be helpful. But Wi-Fi has been shown to actually, in some research, to be immunosuppressive, which is a problem because if you're in the hospital with this type of virus, or for that matter, any kind of chronic illness, and there's all this Wi-Fi, if it's affecting your immune system, then unfortunately, you may have to be there, but unfortunately, that's potential consequences of Wi-Fi. All right, and then the last lifestyle to talk about is just this concept of social connection. And now we can't hands in public or shake hands or anything, but we can still connect with each other and be supportive. One thing to keep in mind with all these Zoom calls is, at least Zoom social calls, not necessarily work calls, is that, you don't want to have a whole bunch of Debbie Downers. It's okay to vent, but you really want to be around people who are positive and finding, benefits or looking at this and saying, how can I, what are some good things that come from this? Where can I take control of, my environment? These social connections have actually been shown to support, inflammate or decrease inflammation. So in turn, support the immune health. Be mindful of the elderly and the older people. They have limitations. They're definitely more fearful of going out. And, oftentimes the older people live away from their family. So, the grandchildren, I've seen some creative ways for grandchildren to connect with their grandparents but still staying at a distance in social media. So don't forget that. All right. So this is the section that a lot of people are constantly calling me about, and what can I take and what dose, and I'll step back and say I have to be mindful that the dosing of these supplements, vitamins, herbs will vary. The information I'm going to provide is kind of on the conservative side, and that's why you have to talk to your healthcare provider. Hopefully they know about this. I'll tell you more than likely they won't, which is why we are going to offer some opportunities to have more tailored conversations, because some people may end up needing higher doses, and this depends on your medical conditions, potential side effects. It's also important that you're getting in the right supplements. You going to CVS and Target, unfortunately, is probably not a good thing during this time, because the quality of the product does matter, especially if you're relying on this nutrient, this vitamin, this herb to do what it's supposed to do in the setting of COVID-19. So the vitamins, herbs, and supplements, they're designed to enhance the immune system. They're going to decrease viral growth and then reduce symptoms. Some of the vitamins that are pretty common that you'll see in your multivitamin. People always ask me, well, can I just take my multivitamin? It has the A and the D and the C and the Z. And I say, well, you can, but you're not going to get these doses. And, if it's a CVS brand, I'm going to question it. So oftentimes you do have to take separate vitamins because of the dosing. So vitamin A in 25,000 IUs is actually a pretty conservative dose. We can go higher, especially as the disease progresses. Vitamin D3. Now, with D3, remember, it's got to be D3 and not D2. A lot of doctors don't know the difference, but D3 is actually the active form. D2 then has to be converted. So make sure you get vitamin D3. Some people will load really high at like 50,000 units for a few days and then go down. Once again, this is where we have to tailor to the individual. K2 is important, especially if you're giving higher doses of vitamin D3. K2 helps keep calcium where it's supposed to be in the bones and away from the blood vessels in the heart. So K2 is important. There's some caveats to K2. If you're taking blood thinners, you have to be careful. So once again, don't do this by yourself. Make sure you're talking to somebody. Vitamin C. We've been using vitamin C for forever. We now can offer it in an IV form. Actually, I got mine before all of this started. Vitamin C, it comes in different formulations, and what we usually recommend is a liposomal formulation, which gets into the cell, which is where you want it to be. The dosing will vary. Once again, some people dose pretty high as a loading dose, but in general, 1 to 3 grams to bowel tolerance. And what that means is you keep taking it over the course of your 24-hour period, or the time that you're awake, in smaller increments. And then once you start to have loose stools, then you've reached your capacity. I mentioned melatonin before, and I'll talk about it again because I think it's a simple, easy to use a supplement that may be very beneficial, and it has other properties like neuroprotective. So if you're older, trying to keep the brain healthy, it has anti-inflammatory, antioxidant properties. That it's the substance that I said it helps you fall asleep. It counteracts cortisol, so it helps you fall asleep, and cortisol goes down at night. The dosing is here, and it's usually a time-release formulation. Now, something's interesting, and melatonin is, we find that melatonin is higher in kids. I don't know if I said this before, but one of the reasons why we think melatonin is beneficial in this COVID-19 and why kids and pregnant women don't necessarily have is the rates are lower is because they have higher melatonin levels. So, so that's, it protects the kids. Don't worry about the details. This is just to try to give you some examples of herbal interventions. I mentioned before curcumin, which is turmeric, the spice. Resveratrol is, that's in red wine. So balancing out your bitters with your alcohol. If you're going to do red wine, remember, try to get organic if possible. N-acetylcysteine and PEA are other herbs. The interesting thing is the PEA is actually associated with the endocannabinoid system, and I haven't read any literature on CBD and and its effect on coronavirus, but we know CBD oils are beneficial for anxiety and sleep. So I suppose indirectly there's some benefit. And then I've talked about probiotics. There are a lot of different doses of probiotics. Sometimes people feel like if I take the really, really high doses, I'm going to get more benefit. That's not always the case. So there's some nuances to that as well. I'm showing this again to lead into the treatment and like where you actually start to intervene. A lot of the vitamins that I mentioned, as well as the herbs that I've mentioned, can be used throughout. I mean, a lot of them are prevention, so you can do them in the beginning before you obviously get sick. But then as things as things may progress, you may decide to increase doses. I mean, of course, working with somebody, increase doses, or also implement some of these additional treatments. Like Cystis T I mentioned, this is actually helpful for keeping from not allowing the virus to attach to the mucosa, like the throat, also the nose. So drinking this, gargling with this is helpful. Propolis it comes from bees. They actually they cough it back up, and well, I guess they're not really coughing, but they bring it back up. And the benefit of propolis, it actually acts as like surfactant. Remember, I mentioned to you the surfactant is what sort of coats the alveoli and is helpful to keep the airways open. Propolis has that property, and then it also has benefit is an antiviral. It sort of decreases the entry of the virus into the cell. as disease progresses, higher doses of vitamin A, potassium, you have to be careful with. It's in this condition, people lose potassium in their urine, so replacing it may be necessary. It's tough because normally we test blood levels because we don't want people just taking random potassium, because if you're taking too high a dose, it can cause some arrhythmias. Andrographis is similar to propolis in that it's used to sort of as an antiviral property. It sort of increases the surfactant as well. Other antiviral supplements like licorice, and zinc is another one. People hear a lot about zinc lozenges, but the interesting thing about zinc is that when zinc gets into the cell, that's where it exerts the effect on the antiviral properties. So the goal is to get zinc into the cell, and these are some like green tea and quercetin. They're called zinc ionophores. They sort of shuttle the zinc into the cell. The other thing that you may have heard about in the news is the hydroxychloroquine, the antimalarial. And although we're not sure exactly how it works, one of the thoughts, the research shows that it carries the zinc into the cell, and that's once again the benefit that we get from hydroxychloroquine. And then I mentioned already vitamin C. Just remember, liposomal is probably better, but you can also use it in the form of ascorbic acid. This part is sort of in the hospital, right? So, and this is not necessarily where, anyone who's listening to this is probably dealing with, because you hopefully aren't in your hospital looking at me talk about this. But the cytokine storm, that's the condition where there's this overwhelming inflammatory process that occurs, and that ultimately can lead to end organ damage and then ultimately death. Folks in the hospital are not sitting around giving them extra vitamin D, although interesting, in other countries where they're a little bit more open-minded. Even in the hospital setting, they're trying to incorporate some of these natural remedies, in addition to, of course, what's necessary to be, in a hospital setting. Vitamin C, actually, IV vitamin C, the same stuff that I was getting, that I just mentioned, they're giving it to patients in the hospital, even in the United States. And, there's some promising research or results that come from vitamin C. We're winding down, and I kind of want to put everything into perspective. The World Health Organization has a statement where they basically say health is not merely the absence of disease. And that's important because we tend to have, many of us have conventional medicine doctors, right? And so you see your doctor because you have a disease. If you don't have a disease, many people don't see their doctor. Or you go to your doctor for a checkup and they do some real preliminary basic labs and you don't have a disease on those labs, so they say you're fine. Well, this is not the time to sort of guess whether or not or understand whether or not you're healthy or not. This is the time to really start to test and to really understand, well, how healthy am I? What does my immune system look like? It's not a single blood test, right? I mean, I'm not going to say we can just do one blood test and then I can give you on a scale of 1 to 10 how healthy and strong your immune system is. It's looking at multiple variables. It's looking at some labs, it's looking at stool analysis for your microbiome. It's understanding your history. It's understanding what medicines you're taking now, what diseases you have, are they controlled? So there's a lot that we have to kind of go into to be able to provide patients with a better understanding about their health. And that is really what functional medicine is about. It's really delving deeper and understanding the person and not really just saying, oh, you don't have diabetes, so you're healthy. I will see healthy patients, quote unquote, healthy patients come in. And when I really do the tests, they're like, well, I didn't realize I had that deficiency and I didn't realize I didn't have that. And I didn't know I was pre-diabetic. So a lot of it is and really important knowing sort of where you stand. And my last slide is this is sort of how I feel sometimes. And I know this is how my husband feels, but the doctor says, good news, you don't have coronavirus. And the father says, but can you still quarantine me from my kids? So for those of you who are out there, I understand, and hopefully we will get them back to school soon. If not this year, then maybe next year. So for those people who are interested in sort of learning more about, what they can do, you can go ahead and there's a link, and you can set up a brief call with me to talk more about sort of individual questions and concerns that you have. And then we can move forward with creating, understanding what your immune system is and really creating a tailored program for you. So I think we're going to put this in the chat so everyone can take a look at it. I am going to exit out, and I think at this point, I'm going to try to answer some questions. I do have some questions from people that sent some prior to the actual meeting, and this is where the technology comes in. I want to try to look at the chats. Okay, let's look at the chats. All right, so if you have any questions, and I don't know if we mentioned this in the beginning, but if you have any questions, I'm going to have you put it in the chat room, but send it directly to me. Or I suppose you could send it to the host, but you'll see my name and then you'll see Capital Rehab Host. While people are asking questions, I'm going to answer some that people have already sent me. One of the topics was related to supplements and dosing. So I did provide some information, and we have handouts if you're interested in some of them that you saw during the presentation. Dosing really needs to be tailored, and that's where it gets a little bit more personalized, because we can give some general broad recommendations, but as I said, some people need more than some people actually need more or less for that matter. So so we really have to tailor it. As it relates to supplements, the other thing is you have to, quality matters. There's a few companies that we work with that I trust. Really, a lot of it is about knowing the company and the quality of the company. That's going to be important, because I think if you're going to try to use a supplement to serve a purpose, you want to make sure that what you're getting in is what you're actually, expecting to get. Question about, do you recommend shutting off Wi-Fi on your phone at night? And yes, I think you can, power down your phone. You can even turn off your router. There are some people and they also have routing blocking devices. So anything that you can do to try to limit that. And even during the day, if you don't need your Wi-Fi, turn it to airplane mode. There's no reason why it needs to stay on. Someone asked about elderberry. Yeah, it's interesting. Elderberry, people were concerned because of its effect. Would it cause more problems? And elderberry has been used for years. And the dosing for elderberry is such that, we don't expect it to cause any problems. And in fact, it is beneficial. It's not necessarily the first thing I would use, but definitely would incorporate, it can be incorporated. Another question about fish oil. I like fish oil. I think there's definitely, it has anti-inflammatory properties. It's important to get the balance of omega-3 and omega-6. So yes to fish oils. It would be also one of my, and I actually recommend it for just general health. We use it in patients who have cardiovascular disease. So, once again, these are people who have higher risk. So using high quality fish oil can benefit these patients especially. Let's see. All right. Oh. Hopefully people are able to hear me. There were some comments about my voice being a little bit too low. Okay. Other things that people have asked me about, oh, testing, right? Of course, we'll talk about testing. With testing, it's still, I feel like it's still all over the place. It really depends on location. In other words, some states, I've had patients where I just wrote a prescription and they actually, they just easily took it to the hospital and they got the test, the nasopharyngeal test. And then I have other patients that, or people actually that I know that clinically they must have had it. I mean, they met all the checklists, they met all the criteria, and the hospital that they went to was not going to test them. So that still is not uniform, but we're still using the nasopharyngeal test. There are, if you can get it done, I mean, the harder part is not actually getting it processed. That's what LabCorp and Quest can do. The more challenging part is actually getting the somebody to be, gowned up to do the procedure where they have to put to get the sample, because you really want to get a good sample. Otherwise, the test is not. You get false negatives. Other parts of testing that we're talking about would be looking at immune markers. So, do you have immunity? And that's where we look at the IgM and IgG. There are some commercial tests out there that can be used. The caveat to that is we don't know enough about immunity. So if a person tests and they look like, based off of their antibodies, that they're immune, does that mean they're going to be immune for 6 months, for a year? We just don't know how long that immunity is going to last. So we have to be mindful of that. And then there's also stool testing, which can look at whether or not you have the virus. This is not testing for COVID, which is the respiratory condition. This is actually just looking for the virus. And the beauty of that is it's a home kit, right? So, some people really want that test to know. It tends to be those who, know they've been exposed in the past. Somebody asked about presentation, getting a copy. Yes, sure, we'll figure out how to get it to you. We have your information. Liver. People asked a question about liver. There is, as I mentioned, bitters are definitely an easy, safe intervention. There are bitter herbs. There's, getting in things like choline can be helpful. High doses of choline actually have been used to try to deal with fatty liver disease. Liver is also, that's where the organ that detoxifies. So lowering the toxic burden to the body is important. And what that means is, when we think about the toxic burden, it's just, all the chemicals we put on our, the lotions and potions, eating processed foods. These things are sort of toxins that we're putting in our body. And the liver has to remove them, even hormones. So, thinking about how to remove hormones. The gut is important in that, as well as the liver. So, lowering the whole toxic burden can benefit in terms of liver. Let's see. What do you think is the single most helpful measure to support one's immunity? And they asked, is it sleep? I think, so that's a tough question. I don't know if there is necessarily one. I do think sleep is very important. And so I think, and what I find in my patients is, changing diet and lifestyle can be the thing that really improves health overall. I think we're in a different time where we really are trying to be more proactive. In other words, in general, lifestyle is important. What you eat, when you eat, getting sleep, being active, managing your stress. I mean, that is fundamental for all health and wellness. But we're kind of at another time where that's great and you should do it, but we need to take it to the next level. because of what we're experiencing. So I think that's where we're really going to be pushing this more higher potency type of nutrients through the form of vitamins and supplements. SPM active supplement. Somebody asked me specifically about that. It is an anti-inflammatory product. We actually use it after surgery. So we use it in our post-surgical protocol. So yes, it has, and I don't know all the different ingredients, but I think it's kind of a combination of like fish oils, but a little bit more potent. So it has anti-inflammatory properties. I don't know about its use directly in COVID-19, but in general, it is beneficial. If people have more specific questions, once again, I think that's why we want, because people are asking sort of names of products and doses. I think, I really want people to, we can have that conversation, because I need to tailor it to your concerns. There are different products out there. I mean, I can throw out some names that we use, things like Designs for Health and Zymogen and Thorn and Apex. So there's some, companies out there that have good quality. All right, let's see. We talked about dosing. Diets. People are asking like specific diets. I like to think of how you should eat in general for immune health being really clean. When I say clean, it's like, not processed. I don't necessarily think you have to fall in one diet versus another. I think there are some tailored diets. So for those who have, obesity or diabetes or insulin resistance, we're going to lower the carbs. We may even go into sort of a ketogenic, but a healthy ketogenic. If you had to pick one, I think Mediterranean is probably, generally speaking, a good diet. But, in the middle of all this, I'm really making sure people aren't eating gluten. People are like, well, I don't have celiac disease. And that's fine, but gluten pretty much is inflammatory. So unless we do some further testing, I'm just going to assume it's going to cause problems. So you might as well just get rid of it. And you'll be surprised, many people will change that. That's like one thing that they find skin, improves their gut, improves their mood, their focus. So, lowering inflammatory foods, I mentioned sugar. But the other thing to think about is intermittent fasting, because intermittent fasting can, of course, help regulate blood sugar, which is important in the midst of all this. But intermittent fasting can also help with the microbiome. So indirectly, intermittent fasting, we use it a lot in weight issues, but, for reasons I just mentioned, it can benefit the immune health as well. Question specifically about lupus. I don't think I wouldn't take a disease and say, if you have this, you should only use these products. I think with certain illnesses, you do have to be more, you have to think about, well, how controlled is the condition? And this is not lupus or anything else, is your condition controlled? Are you on certain medications that are, for this condition that could be, could interact with some of these herbs and supplements? So with any disease, we have to sort of look at that in the context of the sort of more details of the actual condition. Somebody asking about diffusers, certain oils that are better than others. Yeah, I like, I work with doTERRA company, and they have a oil called One Guard, and I love it. I've been using it for a long time. I give it to my kids to put it in the diffuser when they catch colds or start to even, more severe like flu. I will put it in little capsules, and they'll take it, we'll mix it with water in a diffuser, and a combination of ways. So that's a good one. And it has a combination. So it's On Guard, but it has a lot of different oils within it. And then things that open up the airways are helpful, like peppermint. Some people have some digestive support. There's some digestive oils as well. And if we're talking about aromatherapy and just, oils that we're trying to use to help sort of manage our stress, that's the lavenders, rosemary even. and there's one called Clary Sage, and then there's some that are more tailored for focus and tailored for meditation. So combinations of oils can be helpful. All right, let's see. Oh, somebody asked about functional medicine. So, functional medicine is, I kind of brought it up, the assumption that everybody knew that that's what I practice. But, functional medicine is a way to, it's an approach to taking care of patients, where we really focus on the patient and not the disease. I'm trained conventional medicine, so I'm trained to treat diseases. Functional medicine has taught me how to treat the patient. And you would think, well, they're the same, but they're really not. And in functional medicine, we tend to see complex patients, but we approach the patient by, I say complex patients, I mean patients with complex conditions, multiple symptoms, multiple things going on. But we approach it in a very systematic way where we look at the person and we look at sort of the underlying cause of their problem and not just giving a pill for their symptom that they have. But then in functional medicine, we also see, people who just want to be really healthy and they know that we can test at that level. So we can do advanced testing to assess, genetics or the microbiome that I've been talking about. We can do a deeper dive into, autoimmune conditions. So in functional medicine, we're able to explore nutrition at a deeper level. What deficiencies do you really have beyond just the vitamin D that hopefully your doctor is at least testing you for? But we can look at a multitude of vitamins and minerals and see what your body needs. And so people use that and they say, I want to see this doctor so that I can maintain, my health, or I want optimal wellness. So we can provide that in the setting of functional medicine. Antibiotics. All right, somebody's asking about antibiotics, and I'm assuming antibiotics is what we're doing. Right now, we don't have a regimen, right? I mean, you've heard, well, we don't have a definitive regimen. I'll say in other countries, they're using combinations of hydroxychloroquine, azithromycin, and zinc. And some research supports that this has been helpful. It's actually getting people, improving their health in the hospital and getting them out. And other people, before they even get to the hospital, they'll use this regimen and they will, and they've improved. Now, I have to be careful because these aren't sort of FDA approved for this specific virus. And there are people who, you can have side effects. Side effects for any medicine, I mean, obviously anything that you take will have a side effect. So you have to weigh, is it worth it to use this regimen, even though there may be side effects? And we have to just do more research to really determine that. All right. Okay. So I think that's pretty much the questions that I have, and looking at what people have mentioned in terms of questions. I'm going to finish and say, thank you all. I don't know who's still out there because I don't have access to that right now. If you have any additional questions, you guys can reach out. Once again, set up some time, we can talk more. And I just really want to thank you all for coming out. Please share this information to family, friends, loved ones, so that they can, benefit from this as well. So thanks, everybody. Good night.
Good night, and thank you.
Thank you so much.